Don't let your doctor transfer more than one embryo at a time. In the past, when IVF was still a young science and the pregnancy rates were low, we would routinely transfer 2 or 3 embryos at a time to increase the chance of the embryos implanting, which is why IVF twins used to be so common. However, now it's a global best practice to transfer only one single top-quality blastocyst at a time because this increases the chance of a singleton live birth, the best outcome of an IVF treatment cycle. Equally importantly, this strategy saves the remaining frozen embryos for the patient, so that the patient can come back for another attempt in case the first cycle fails. Once embryos have been frozen, they can be thawed and transferred, one at a time, and the pregnancy rate with the transfer of a frozen thawed embryo is better than with a fresh transfer because the endometrial receptivity is optimal in a frozen cycle. Also, since transferring a frozen embryo is much less expensive and does not need any injections, it's much kinder and easier for the patient. So why don't all clinics follow global best practices? The reason is that many IVF clinics aren't well equipped, and as a result, they take multiple shortcuts to complete the IVF cycle. Because their IVF lab is not good, they aren't sure of their ability to routinely grow embryos to day 5, which is why many clinics routinely transfer many embryos back into the uterus on day 2 or 3 with the hope that at least one will implant. The poor patient doesn't even understand the difference between a day 2 transfer and a day 5 transfer, because they're so dependent on what the doctor tells them, and they blindly trust the doctor. These doctors take their patients for a ride, and this can be an expensive mistake. When the doctor transfers day 2 or day 3 embryos, they often end up transferring to 3 or 4 of them at a time to increase the chance of achieving a pregnancy, which means some of these patients will then end up with triplets, or some of them will not get pregnant because they don't have any more embryos left. They'll be forced to start a new fresh cycle, which is great for the doctor, because then the doctor can charge more money for doing a fresh cycle, and the doctor doesn't care. But as a patient, you should care, and therefore you should insist that the doctor freeze all your embryos on day 5, and then thaw and transfer them, only one embryo at a time. Using this strategy, your cumulative conception rate, your pregnancy success rate over time, with one single egg collection cycle will be much higher. Typically, with one egg collection, your doctor will retrieve about 12 eggs, and you may end up with 4 top-quality blastocysts to freeze, if you are young and your egg quality is good. Now, if you transfer these one at a time, you will end up doing 4 transfers, for the cost of much less than doing 4 fresh cycles. In fact, the pregnancy rate with this approach will be actually much better, because the success rate of embryo implantation in a frozen cycle is better than with transferring embryos in a fresh cycle. This is the strategy that all good clinics all over the world follow these days, because the technology for freezing and thawing embryos has become so good today. When we vitrify them, the survival rate is nearly 100%, and good labs can routinely grow embryos to blastocysts. Tragically, lots of Indian clinics don't bother to keep up with the times, and even though they tom-tom about the advanced technology they use on their website and their press releases, they refuse to share embryo photos with their patients. They take advantage of their patients' ignorance and continue doing pretty much what they've been doing for the last 10 years. This is why we still see IVF patients with multiple pregnancies, which is an iatrogenic complication and completely unacceptable. What's even worse is that these patients are subjected to multiple fresh IVF cycles and multiple egg retrievals, which helps the doctor's bottom line, but doesn't help the patient's success rate at all. Need help in getting pregnant? Please send your medical details by filling in the form at www.dramlapani.com/free-second-opinion so that we can guide you. For further queries, you can contact us on WhatsApp on 9867441589.